best treatment for under eye hollows and dark circles? I have under eye hollows as well as dark purple circles within the hollows that have become more prominent every year. I've always had the under eye hollows, which progressively look more sunken. I'm tired of constantly looking tired. I've read about Restylane being a good option for this area, but is it the best treatment for my situation? What are my other options? If I received the Restylane filler treatment, would it help remove the dark circles too?
Thank you for your question. You've submitted some very good photos and you're asking about treating the dark circles under your eye. And you describe it very well as purplish, and it's very important to understand the basic cause of the dark circles. And I know you asked about Restylane as a possible treatment. So what is it that makes your eyes look so purplish and tired? Well, dark circles are typically caused by hereditary ethnic dark circles. So for example, a lot of people of Indian origin, Arab origin, will have dark circles because of pigmentation, genetics. Other things that can cause dark circles has to do with actually the opposite, lack of pigment. The absence of pigment, or the thinness and quality of the skin, where the skin is almost transparent. Eyelid skin is only 0.5 millimeter in thickness. It's very, very thin. So you can literally see through the skin and look at the blood vessels and the muscles, and that can create a bluish hue. Now, many times people who are very light-skinned have this issue. Now, things that can aggravate this issue I have seen include smoking and sun exposure. Anything that causes the skin to be thinner can cause this dark circle appearance to progress even further. Now, although a filler can help fill in a hollow, it can't completely reduce the dark circle appearance completely. But something that I noticed about your photos that you didn't mention in your question is there appears to be some lower eyelid fat prolapse. Now what that means is not only do you have the dark circle, but you have a bulges of fat pockets on the inner aspect that are making the eyes look puffy. Many of my patients over the 20 years of doing this have complained of dark circles when they first came in, and then when I pointed out to them they also have the fat pockets, we decided that a combination approach would make sense. Now what does that mean? Well, think about it this way. If your eyelid is very thin and the skin is accentuating everything by the translucency of it, well, if the fat pockets are pushing forward, it's like you're pushing that appearance of dark circles forward. And when people look at you, we look at ourselves with great detail, and whatever we see, we tend to focus on and magnify. That's why a lot of people come to our office. They come because there's a dominant issue that concerns them that makes them want to seek attention. So when I help people with situations like yours, very often I'll do a combination where I would address the fat pockets, and if in a younger person what appears to be, it may apply to you based on your photos, I would do something called a transconjunctival blepharoplasty. Now what that means is I would go from the inside of the eyelid and address the fat pockets so they're not pushing forward and bulging, okay? Now that can help take away the accentuation of the dark circles. I also routinely will combine that with the use of platelet-rich plasma and sometimes with fractional CO2 laser. To help you understand that a little bit better, platelet-rich plasma is derived from your own blood. We do a typical blood draw like you would at a lab for your blood tests, and we spin down the blood and we concentrate the part called platelets. Platelets have the healing factors that you need when you cut your finger or cut anywhere. When it's concentrated, it stimulates new collagen, and in my practice I've observed that the skin quality of our patients improves. I've used platelet-rich plasma in eyelids and all over the face and in scars, and I even use it in combination with a material called extracellular matrix for hair loss. So there's a remarkable flexibility in the many uses of platelet-rich plasma. Now that combined with laser, where we're doing something to generate collagen from a different way through the delivery of thermal energy, we can improve things. Now, if you want to try to reduce the accentuation of the hollow in the tear trough, that's where a filler like Restylane comes in very, very useful. Basically, there's an art to applying this material, this hyaluronic acid material, in a way into the tear trough. In fact, I routinely combine platelet-rich plasma with hyaluronic acid because there appears to be a synergistic benefit where the two together seem to create this nice volumizing, healthy look. Now, like any other hyaluronic acid filler, it does break down, so it does have to be repeated. But I think you need a proper examination and evaluation. So I would suggest meeting with experienced specialist in the eye area who does a lot of cosmetic work and is familiar with cosmetic eyelid surgery and injectables for the improvement of under-eye hollowing, and learn more about your options. It's very important that you have good communications so you understand what to expect. I would suggest think about improvement, not complete reversal, because complete reversal I don't think is practical. And on top of that, if you're doing anything that causes a toxic internal environment, whether it's smoking, not sleeping enough, a lot of stress, all of those things show in the eyelids. If you look at almost any American president, the first day and then at the end of 4 years, it shows in their eyes because this is a tissue that is so delicate and tends to age is very sensitive to aging and stress. And so that includes smoking, sun exposure, and all the other things that can be toxic. So I hope that was helpful, and thank you for your question.